Yes, sir. Mr. Hannon, is the retroactive piece on, it's at line 9, is that necessary to make this bill retroactive?
Well, it says that you're not talking about before,
Mm-hmm.
2006.
Mm-hmm.
Legislative council put that in, so I'm sure it was.
Okay. Okay. Sometimes we do legislation. It becomes active at the signature of the governor or by July 1st. Do you think the January 1st, 2006 would make it retroactive? Do you feel that's necessary?
Well, this is become effective with the signature of the governor. Sorry, that's on line 14.
Yes, sir.
Okay, but all that is saying is we're not talking about retroactive. I don't know if it's necessary because there was no retroactiveness. I mean, everybody was. So I don't know if that's necessary or not that day.
Okay.
I just took it because legislative council knew what I was trying to do and they put that in.
Okay. Okay.
Representative Dodson.
Mr. Hammond, I appreciate what you're trying to do here, and I do understand it, and probably I don't understand it to the point that the problem is a problem because I live in the metro area and you live in Parrott, Georgia. But the problem I have with provisional credentialing is that the purpose for credentialing, first of all, is to make sure that the physicians are qualified physicians. You agree with that?
Yes, sir.
And I'm going to speak from kind of a hospital stand here. We go through a credentialing hospital, and I'm not a healthcare person. I serve on the board of a hospital, but we credential the physicians before they are admitted to serve in the hospital where I'm on the board. And it's not something that can just be done overnight. There's a lot of things that come into play, and I would almost think that part of the things that came into play here is the paperwork not being filled out properly by physicians, because they're much better caregivers than they are paperwork providers, if you know what I mean. And I think that this has a 60-day clause in it already, that they're to be credentialed, which I think is more than fair. I think that's really very quick.
Can I ask you where the 60-day clause is?
That's what the Department of Community Health, I think, said they were going to do, or United Healthcare, I think, said they were going to do them within 60 days.
Is that in the contract?
I've never seen the contract.
Or
And
you've been told that was in the contract. I'm not trying to cut you
yeah.
off, but we've got a copy of the contract here, and I've had 4 lawyers looking through it, not me, and we can't find 60 days in there.
Well, and I'm sure I couldn't either. But let's say that it's 90 days, and that's still, I think, for credentialing is pretty quick. I'm not going to argue with you and saying that we don't need this, but I'm afraid that we're going to be opening doors to lawsuits that I don't know if United Healthcare would be responsible for or the state of Georgia. If a provisional physician came on that really was not suited for the plan, and I don't know if there's if anybody can answer who would be responsible in that case, of a lawsuit. I know that in the event of pregnancy and some of the other reasons that I think this bill would be necessary, the Patient Protection Act that we passed about 4 years ago, I think, would cover these, where if you are pregnant, or if you're a female and pregnant, I hope you're not, that they can continue with their same physician until the delivery and so forth and so on. I'm not arguing with you. I'm just saying that, I see this as opening a lot of doors that the state could find problematic. I don't have the answer. I don't guess. But I want it also to be those that next year, and I know there's a provision that this sunshines in December of 2007, but that we don't have something like this that keeps other carriers from wanting to bid this product in the state. So
That's the reason for the sunset.
yeah.
Because that's the reason there. I understand what you're saying, and patient safety is very important for me also. But my point is, if December the 31st, a doctor is credible enough to work on the patient, then what's wrong with January the 1st him being that way? And while he's being credentialed, while he's being officially credentialed, certainly patient safety is number one. But actually, access to health care is very important to us as well.
Well, can I follow up with one question, Mr. Chairman? Are you saying that this only is covering physicians that were credentialed on December the 31st, but they're not on January the 1st?
Yes, sir.
Where does that say that?
Line 4, page 1. Line 4, page 1 says, healthcare providers that had previously been approved.
Okay, I don't have any other questions right now, Mr. Chairman. Thank you.
All right, Chairman Watson.
Thank you, Mr. Chairman. I just want to say that for the last 3 weeks, we had this bill in our committee, and I think Representative Hurd probably said it best in the meeting this morning, that there is a problem that persists with credentialing, and it might be a problem that I think Chairman Hanna has down in his problem, but I think that there's something that we need to be done. I just had a question of the author, if I could, but I want to just make it plain. We had 3 meetings on this bill. We asked all parties, whether you were a provider, carrier, the department, whomever, to get with Mr. Hanna and try to work it out. And we had 3 consecutive meetings. And I was a little disturbed, like Mr. Hurd and Mr. Davis this morning, that the parties didn't get together. And I think any time that we try to make government good for our people, departments, insurance carriers, providers, they have to work with us to try to get it done. It just took 3 meetings. And I just want to say, Mr. Chairman, next time I won't do that unless you direct me. But I won't do that because the parties did not come together, and we met 3 times. As a matter of fact, you chaired one of me because I was late. And I just think that if we're going to make good laws and departments have the information, and carriers or the American Cancer Society, we have to work together to make these laws. And I'm not going to do that again, hold 3 hearings to hold up a bill that I think is very important. With that said, Mr. Chairman, I think that the only problem I was having is that the window of opportunity for the credentialing process. Is there anything that we can do about this window of opportunity? I think the sunset you have is December 31st, 2007. Is there any other window that we could deal with?
I'm not sure I understand your question.
Well, I'm trying to shorten the window. I know that there's something needs to be done. I know that the department has said that they would come out and help you in your area with the credentialing to try to get those doctors sign the contract once they sign the contract. I'm wondering about on line 12, page 2, about the sunset date. Is there any opportunity for a window of opportunity for us to come back next year and try to fix it if it was shortened? Is it January 2007? I'm not sure. I'm just asking a question.
I don't have any problem with that. January 2007, I don't have any problem with that.
Okay.
I think surely the process will be done by then.
Okay.
I don't have any problem with that.
Thank you, Mr. Chairman.
Are you proposing that as an amendment?
Well, I want to make sure the author look. Yeah, I would like to propose at the proper time.
I think I hear the author saying he has no objection to that amendment.
Talking about January 2007, right?
Yes, sir.
I don't have any problem with
Page 2, line 12, strike December and substitute January.
We know what problem persists, and it gives opportunity to come back and work on it as a body.
Well, hopefully by the time we roll around to this problem will be solved.
Right. Okay.
All right, and let's see, then we have Representative Dollar.
I'll wait for now.
All right, and then Representative Golick.
Thank you, Mr. Chairman. Mr. Hanna, I'm not a member of that subcommittee, so I'm new to the issue, so bear with my ignorance as I go along. How many people, how many providers are we talking about that have not been credentialed who need to be credentialed?
that.
As a
There's no way I can give you the answer to that. I don't know that anybody can give you the answer to that.
Because I know, I'm sorry.
I know I'm receiving emails daily. We had somebody here for the subcommittee over in southeast Georgia. We had 200 some odd doctors say this, another thing, just because you're credentialed doesn't mean it stops. You also after you get credentialed, you have to have an effective date, so it even lasts longer than that, so, but I can't tell you how many people are talking.
What I'm trying to get to, Mr. Hanner, is just what is the weight of the problem right now? I know during the transition it was a big problem in the southwest area of the state.
I can just say I'm receiving emails daily, and it's not in my district alone. It is mostly rural Georgia.
Okay, and I know that during the transition there was a problem. What I'm wondering is between then and now, how many physicians have been credentialed, how many are under contract but have not yet been credentialed, and how many days have passed.
I cannot tell you
In
that.
other words, if they've been contracted and they're over, I understand that the time frame under NCQA standards is 60 days. Is that right?
We have not found that
Okay.
anywhere written down.
Is the 60-day, is that a standard by which they have got to be credentialed one way or the other?
We've never found that written down anywhere where it has to be.
Okay, so there's no standard by it in terms of,
As far as I know.
okay. I'm trying to figure out, Mr. Hanner, just in terms of, you've got X number of providers who have wanted to be credentialed, and I would like to know at the appropriate time from whoever, how many have been credentialed. And then, if I could just finish, and then how many are under contract but have not yet been credentialed, who should have been credentialed in a timely manner. What I really want to know is who's done everything, how many providers out of the total universe of providers within state health benefit have gone through the proper steps and yet not been credentialed. What I really want to know is what percentage is that of the whole provider population for the plan, because I think that's a relevant question.
I think it is, and I think, you may see that, it could be you could say 90% of the providers are credentialed. But if you look at that, 90%, then, maybe 10, 12,000 up in the metro area, but the problem is down in rural Georgia where we don't have that big population. And let me say again, if the number is very small, we still owe that, I think, our teachers and our state employees. If the number is very small, to allow provisional credentialing.
Well, is there, I guess,
I'm trying to put blame.
no, understood. And I'm just trying to make sure I understand an issue that I frankly don't understand. If a provider is under contract and they've signed a contract, they're going with the plan, United, whoever. What I really want to know, Mr. Chairman, from someone at some point is what the requirement is time-wise for that provider to be credentialed. Is there a requirement? If there is a requirement, who mandates that requirement? Is it state law? Is it some sort of standard that, that others use, whatever it might be? And the question is, who's not been credentialed in a timely manner? If there's a timeliness issue on they who credential, United, DCH, whoever, I don't even know, then that would make me upset, because then those people aren't playing by the rules. But if you have a vast majority of the provider population that are under contract, they've been credentialed, and they are working, as opposed to a small number who haven't, then I wonder about the necessity of legislation to address a very small percentage. Now, that being said, let me qualify that by saying, if that percentage is concentrated in your area, then I'd be standing right where you are right now. Don't get me wrong. But I do wonder about the necessity for legislation if, in fact, that percentage is small. And I'm not saying that it is, but I do want to know, Mr. Chairman, at some point, what it is from somebody. And I appreciate it.
All right.
Let me just, may respond.
Sure.
If the percentage is small, I still think the bill is needed to address that small number.
And the question is, Mr. Chairman, if I
And
could...
I don't know if anybody actually knows the exact number.
And if I could follow up, Mr. Chairman, if the percentage is small, well, what is it about those particular applicants that has made them not credentialed? Is there a credible reason why or why not? I'm not surprised to hear that.
I guess I've been thrown into the responsibility of telling who's next. Matt Dollar, Mr. Dollar.
All right. I'll reiterate what Representative Dodson said earlier. I'm from the metro area, and I was not aware that this was really a problem until you pulled, we spoke about this on the floor today, and I didn't know that the bill was on the agenda today. I believe it was added believe it was added late. I also don't really understand the process all that well. My concern, and I think it's something that we need to be conscious of, is setting a precedent by doing this. That's really that at this point. I don't know about the percentages either. I don't have concrete numbers, but that's my main concern with this action. And I didn't know if you could speak to that.
Well, I can just say, I'm afraid if we don't do something like this, we'll set a precedent. Because you've got people, state employees and teachers, that had adequate health care December 31st, and then they couldn't see their own positions January 1st. I mean, that's what the problem that we're facing, and I certainly don't think we're setting a wrong bad precedent.
Okay.
Representative Jackson.
Thank you, Mr. Chairman. Mr. Hanna, isn't it true that, thank you, isn't it true that hospitals give provisional credentials all the time?
I believe that.
And it's also true, sir, that there are many licenses that we give provisional license to healthcare providers all the time. Right. I want to go back to my original question, and I want to help you out. I think there are about 150 some odd physicians that are not yet credentialed, but I think that the vast majority of them live or practice below the net line. That means areas south of Macon. But I want to go back and say the retroactive piece, is it not true that's necessary? Because if that physician that has a provisional credential right now, if he practiced on someone and we don't pass this legislation, he won't get paid unless we put this back date on it? Or will they still be getting, or can they still qualify to be paid for their services?
Not in network, no.
Okay.
And also the patient will either have to pay out of network or go somewhere else.
Okay. And there are a lot of counties in southwest Georgia or southeast Georgia that has maybe one physician or two physicians in a county. And if that one physician is not credentialed, those patients may have to go elsewhere, usually out of the county or other places. It's not like the big metropolis of Savannah, Georgia, where there might be more than one physician around the corner.
Very true, very true. It's 2 weeks ago, we had a report from an oncologist in southeast Georgia that could not get credentialed, was having trouble in the time-wise getting credentialed, and people were having to go 50 miles away for chemo because they could not afford to get that out of network. And that's the kind of problem we're having. Thank you.
Let's see, was that Dr. Jackson last?
Yes.
Okay. Then Speaker Coleman.
Thank you, Mr. Chairman. Mr. Hanna, isn't this just a case of taking care of state employees and teachers where we give them a continuum of care? I mean, let's not blame a United or a Blue Cross Blue Shield. The TPA has chosen a network. The network is slow in credentialing people. And people who've been using, this is a personal thing, if you use a doctor, whether you be male or female, it's a personal choice. If they were in the network previously, which is a state employee plan, not an individual company plan, but a state employee plan, if they were in the network before and the state employee was using that physician, all you're saying is that until either the TPA or the network they've chosen to administer this health care service gives them a yes or no on their contract, that we're going to consider them as still part of the network. That's all it is. And this can all be solved if the people who operate the network or the TPA writes the doctor a letter and says, you are no longer have a contract with our network or our statewide service, or we want you to stay with us. And I mean, that's just that simple. We're just saying to people, hey, we're going to help you because we are not a normal group plan. We're a state plan operated by a TPA that we chose in a competitive bidding process, and we want to make sure that the teachers, state employees are taken care of until the TPA or the network chooses to enter into a contract or not enter into a contract with this physician. Isn't that pretty simple?
Yes,
and to pay them just like they were credentialed until they're told they're not credentialed.
That's the reason I began my remark by saying it's very, really simple matter.
And it ends, as I understand it, doesn't affect anybody that might get the contract in future years. It does not tie the existing TPA to this person who might be credentialed temporarily or provisionally. Now, anytime after they say, if they want to say, no, you're not going to do business with us, then it's over with. We're not going to require them to pay them or require them to see state employees. If they see state employees, they pay out-of-network charges, right?
Yes, sir. That's
Okay.
correct. Thank you.
All right, let's see, Representative Davis.
Thank you, Mr. Chairman. As a member of the subcommittee, we, as stated before, we went over this bill for several weeks, back and forth. I have no less than 4 different versions of this bill. I'm going to start with I think there's a lot of issues with the bill, but the main one is I believe it's unconstitutional because it's retroactive. Even though he stated in this contract or in this bill that it can't be construed to affect any impairment of the contract. The contract's already in place, and it's already in the works. Furthermore, the Department of the DCH has informed us that 98% of the people are already credentialed. Now, we heard testimony to the contrary of that, and it has been a very confusing time on that. However, it turns out that a lot of those people that aren't credentialed are not contracted, therefore could not be credentialed. They're not through a TPA, but through an IPA, which apparently United doesn't do. So I'm not sure if the issue is simply credentialing. There's a contracting issue, and I'm very sympathetic, and I discussed this earlier with Representative Hanner. I strongly suggest that the department get together a emergency response team to affect his area and get the problems with the contracting and the credentialing done down there. But if we had a army of people that did 98% of the people's credentialing, why can't we focus all of their attention on the 2% that's left? And I just think the legislation really, we can cure the problem without the legislation. Furthermore, to actually cure the problems that we had during the transition, the bill would have to be in effect for the next transitional period. And this bill being repealed in 2007 would not affect the next transitional period, which would be in 2009. Now, everyone would admit, even including the department, that there was problems with the transition and the credentialing, and there's still a few out there that need to get worked on, and apparently there's a concentration in your district that needs to be addressed. And I just don't think that we can do this legislation. Thank you.
May I respond, Mr. Chairman? May I respond?
Wait 1
Oh,
second.
I'm sorry.
Wait a minute. All right, go ahead, you can respond. I've got a couple more people.
I understand. And I know I don't think you meant this, but let me just make sure for clarification to everybody. It's not my district. It's all of South Georgia, Southwest and Southeast Georgia, so it's not my district. If what I hear you say is this legislation is not needed, what's harm with the legislation? To help, even if it is 2% of the teachers and state employees. That's what my problem is. But it's not just my district. It's most of Southwest and Southeast Georgia.
Representative Meadows.
22. Representative Hannon, I've just got a couple of comments on page 1 that go down that provisional credentialing, and I'd like for you to know where I'm coming from before I start. I'm from one of those sections of the state that has a problem up in the northwest section that y'all know we're around with Joe King. My doctors are not in the United Health Plan. It's not necessarily United Health Plan's problem. When you go through credentialing, and if we did the provisional, I need the spur now to get my doctor to send in his information. He's holding it as we speak. He hadn't said, and the reason he's holding, he doesn't agree with the reimbursement schedules. And if there's a thought out there that we might do something on reimbursements to get him in there, but if he hadn't got something to prod him into going ahead and signing, credentialing can't take place until after the applications are in, and during credentialing, the doctor has to do a lot of work. I mean, every one of them do, and most of them, ever since we've had the consumer choice option out here, I hadn't had one that was happy with doing that work to get that stuff in. So I don't think it's necessarily just one side, but I would have a real problem telling some of the doctors out here, we can go back, and we're going to let you kind of sit here and just keep working, and we're going to pay you, and whatever, I don't know what we're going to pay them. Are we going to pay them what United thinks is fair, or are we going to pay them what the doctor seems to think is fair? I don't think that we can go back and give them back time to January the 1st or anything prior to that. If they haven't been, they got to come to the table too. And my doctor's one of them.
I think you've got several doctors. There's some doctors like that, yes, sir, also. But the ones I'm talking about, the ones that are trying to get credentialed, and it's taking too much time.
Have they got every?
From what I understand the process, once they sign the contract under this, they would be provisionally credentialed.
Once they sign? But
you've got some doctors, you're right, that don't want to join up with United Healthcare. I'm concerned about the ones that do and are trying to get credentialed.
Let's go back to the one you said, once they sign the contract, they can't be provisional. If there's a contract, isn't that what you just said?
I'm sorry, I didn't hear you.
If they sign the contract, is that the ones that
No,
are going to be
if I said
provisional?
that, I'm what this one says is if you were credentialed before, you will be credentialed after January 1.
That's your doctor calling.
And again, we have a lot of problems down there with some of the hospitals not wanting to be to sign up with United Healthcare, some of the doctors not wanting to sign up with United Healthcare. But I'm just talking about the people that want to be signed up, want to be credentialed.
All right. Let me, I didn't mean to cut you off. Are you finished?
I'm through.
Okay. Let me just suggest this. I know Speaker Coleman has a motion. I'm not going to recognize him at this time for that. I have another speaker on here, someone else who's asked to speak. And then I have an abundance of caution. I'm going to let DCH speak if they want to defend themselves if they can this evening, even though we've been over this before. We're going to have a vote this evening. I'm going to try to keep this as short as we can, but we've spent a lot of time on this bill, and I want to be sure that we get an airing on it before we vote. Let's see. I have next. I have Representative Murphy, and then Representative Hurd.
Thank you, Mr. Chairman. You addressed one of my concerns, and that was related to the department responding to some of the questions that we were presenting. So I'll just defer until they make their presentation.
All right, then Representative Hurd.
Yes, Mr. Henner, I know there's some concern about this bill being retroactive, but I think in looking at this, what you have said is actually the services have already been rendered.
Correct.
And the doctors have not been paid, of course, because of the credentialing. But they have rendered these services.
Right. And the patients have had to pay out of network. Yes.
All right. Any other questions of the members? Anyone here from
One little thing here.
Speaker Coleman?
Representative Meadows was talking about his physicians, and I would imagine, Mr. Meadows, there are in excess of 100 physicians up there where you happen to be talking about. In the county, one of the counties that I just recently represented, Telfair County, there are only 2 physicians with 11,900 people in the county trying to keep a hospital open, critical access hospital open. And when they're working 18 hours a day, they quite frankly don't always have the time to fill out this paperwork. Now, they're not trying to get additional money or a better contract. They're trying to serve patients and see them in the emergency room, see them in their offices, and lots of times it's just because they haven't had time to get to it. And I don't see what's wrong with it.
Thank you, Mr. Speaker. All right. Thank you, Representative Hannah. We may get you back up here. Anyone here from DCH? They want to own up to it? Okay. Come on, you're in the pit.
Thank you, Mr. Chairman. Let me first address Representative Golick's question from a few minutes ago. The total number of physicians who are contracted and credentialed in the network is in excess of 12,900. As of today, the number of physicians who have signed their contract, applied for credentialing, but that process has not yet been completed, is 156. Of that 156, only 51 applied before February the 1st. So in essence, we have a group of 51 out of almost 13,000 docs who have applied for credentialing that it was not, it's lasted longer than the 30-day period at this time. To give you just a little bit of background, and I think everybody has acknowledged that this was a little bit more difficult transition than we planned. The department had allowed time in our schedule once the procurement was complete for the vendor to complete their network and do the credentialing and be all ready to go on January the 1st. Unfortunately, our projections did not prove to be adequate in the real world. I think a lot of that turned on, particularly in the South Georgia area, dissatisfaction with providers who were not already in United's network with contract terms that were originally offered to them. Since credentialing does not begin until contracting has been done, the delay in contracting therefore had an inevitable impact on when credentialing could begin, and therefore it was not all complete by January the 1st. However, we do think that we have managed over the ensuing time, we're now on day 60 of the active performance of the contract by United, that they have largely worked through this issue. There are only a handful of physicians, as I indicated, who have not yet completed credentialing. With that said, I'll just lay out what our concerns are about the bill. One, which you have already addressed with the proposed amendment that would modify the sunset date, was the potential chilling effect that the bill might have on future procurements. The ability to have a very competitive procurement is one of the best tools we have to control costs, and as I try to remind people, there is no separate DCH health plan.
Let me interrupt you. What's the chilling effect?
That some of the plans have told us that if provisional credentialing is required at the time of reprocurement, that they would be inclined not to bid and not compete for the business. We obviously want to have as broad and energetic competition as we can, but as I indicated, I think the proposed amendment would largely address that.
So if it sunsets, it's not a problem then?
Yes.
On the January 1st day, Mr. Chairman?
Yes, as amended,
Yes,
January 1st, yes.
That was what I was referring to. The second concern we have Representative Davis brought up earlier, the RFP that was bid upon and the contract with United require that they apply the NCQA, which stands for National, well, I'm sorry, I didn't write down what it's an abbreviation for, but
Committee for Quality Assurance.
thank you. National Committee for Quality Assurance. We required in the contract that United credential all potential members of their network using the standards of that organization. Frankly, that was something perceived as granting an additional level of benefit and assurance to the members that they could be assured that someone had gone that extra mile to make sure that everyone in network was capable of giving them quality health care. Therefore, we think there is a significant constitutional issue with a requirement that after that contract is executed, that United adopt a different mechanism and provisionally credential providers who have not completed their process. We believe that's just problematic as it changes an existing contract, requires them to assume at least potential liability that they had not contracted for. I was not able to find any cases that squarely addressed whether in fact they would be liable, but certainly I also couldn't find any that said they would not be. Certainly at least the potential is there. Finally, our one other concern is that on page 2, line 5, the bill provides that the third-party administrator will approve payment for the providers. I believe I heard that what the author contemplated was that the provider would be treated as under contract so that they would be paid at the in-network rate, and that would protect the member against balance billing. But the legislation does not spell that out, and if that's what's intended, we would request that the committee adopt an appropriate amendment that would make that clear, because otherwise we're not really helping the members if the physicians are not held to, well, I won't single out physicians, if the providers are not held to that and the member is still exposed to balance billing, then we haven't really accomplished anything with a provisional credential at all. Unless the committee has questions, those were our concerns.
Well, let me do this. There may be more than one person that has a member that has a question. Let me just get does anybody have any questions? Let's just get a show of hands. Anyone have any questions of this witness?
Just a quick one.
Representative Golick.
Wrote down, Mr. Childers, the numbers you quoted before, the 12,900. Out of 12,900, 156 have not been credentialed. Of that number, 51 applied before February 1st. Is that right?
The one difference would be the 156 is in addition to the 12,900 rather than being part of it. But other than that, yes.
Does NCQA provide for a maximum period of time by which they must be credentialed?
There is an industry standard of 60 days, but there is no drop-dead provision that on day 61 the person is either automatically denied or approved. The goal is to complete the process within 60 days.
This may not be for this bill, Mr. Chairman, but would it be a practical suggestion that maybe there should be some sort of standard timeline assigned so that there's a reasonable air of expectation as to what's going to happen when with regard to credentialing? But I think this is a pretty minimal percentage as compared to 12,900. That being said, for those 156 providers,
It's an issue.
if they don't, it's an issue because they don't know when the deadline is and they have no finality.
The NCQA is a national entity that sets accreditation standards. They're not our vendor or under contract to us, but we'll certainly be happy to pass that along.
I understand, but you can still put that in the contract, though, for future
Yes,
reference.
we can put it in future contracts. yes.
Representative Davis.
I know we've been all through this, Neil, and I appreciate you bearing with us here. The 12,900, can you tell me how many people were contracted and credentialed prior to January 1st with the previous carrier?
Okay. With that clarification, yes, it was approximately 11,000. There were 2,000 providers who were in the former network administrators network who were not already in United's network going in. And so they managed to get all those, with the exception of those that I mentioned, through the process in a fairly short period of time.
One more real quick question.
Yes.
Mr. Chairman. The doctors that are part of an IPA or that haven't signed a contract, do you know how many I mean, obviously the number's greater than it was before. How many doctors that were in the program before but aren't in it now?
I have to admit, I do not know that number. I assume you mean by choice.
By choice,
Yeah.
whether or not they've decided to sign the contract and choose to accept the fees that United was offering.
Right, that I do not know. I'll find out and let you know.
Question to the...
All right, one more.
No, I'm done.
Oh, okay.
That was mine.
Oh, okay. Representative Hurd.
Thank you, Mr. Chairman. I want to kind of follow up on Representative Goldick's question in reference to the timetable as far as credentialing. Did you not have this anywhere, either in the contract or the RFP, or particularly the contract, I guess, at this point?
There is not a mandatory time to complete an individual application for credentialing in the contract, no.
Is this normally the way you would let out these type of sign these type of contracts without any requirements for credentialing, or something that, particularly when you're looking at something that takes effect on January 1?
The way we approached it was by requiring that they have an adequate network in place on January the 1st.
What's considered adequate?
Let me answer the one question you didn't answer first. I will come back to that. By in place, we define that as meaning both under contract and credentialed. Adequate was defined by reference to various geo-access standards, and then so many doctors of various specialties and primary care physicians and so on, based upon where the members live. And they had to meet those standards in order to be adequate.
Now, so so what you're saying is they met those requirements?
Yes. The issue was that the former administrator in some areas had a network that exceeded those requirements. United met them, but that still meant that there were some physicians who were not under contract and credentialed that did want to be, that they had not yet completed by January the 1st. But the contract did not require them to have every physician from the prior vendor in their network and under contract, because obviously part of that is physician choice.
So the department, okay, so, and if I may say later on, Mr. Chairman, I really think that we need to look at this closer and to see if not there were some other problems that maybe would not have been a problem if they had been addressed during the contracting process, because I think this is where the problem started. It was in the contracting process. And if we can pass this legislation or not pass it, either way, we're going to still have a problem if we don't address that issue.
You won't have this problem.
Well, it'll be another problem, but yeah, it'll be a similar problem, yes, where we have state employees who are not receiving services when needed. And I would hate for that to be one of my loved ones who needed a major operation and was not able to do it.
Representative Murphy.
Yes, sir, Mr. Chairman, thank you very much. Earlier, you mentioned that there are over 12,000 providers that's actually on board now. Am I correct?
Yes, sir.
I'm sure that you probably asked this question, or the question was asked in the subcommittee, but of the 156 providers that we're talking about, what percentage of those would be located down in Representative Hanna's area? Is it just an isolated situation, or is it you find it throughout the state?
It's not just his district or his area, but there are pockets, and I'm not sure I understand fully why. The numbers I got from United today, of the 156, 58 were in Metro Atlanta, the remainder in the rest of Georgia, but I did not ask them to break out beyond that specifically what was Southwest Georgia, what was Southwest, and so on, but the rest of the state was 98.
All right. Members, if there are no further questions, we have before us committee substitute to House Bill. I'm sorry, Representative Hannah, did you want anything further from you?
No,
Time to go.
Just one thing, Mr. Chairman. Thank you
Yeah.
for your indulgence this afternoon. If there's 158 and 58 from Metro, there's still 100 out there that need to be protected with the teachers in the state of Florida. Thanks.
All right. Members, we're on the committee substitute to House Bill 1115, and that's LC 1357S in your folder if you haven't pulled it out already. And I believe we have a motion to amend by Chairman Watson, and I'll recognize you for that purpose at this time.
I would just like to change with the Office of Commission on page 2, line 12, that this code section stand repealed on January 1st, 2007 as amendment to LC 331357S.
Do I have a second?
Second.
All those in favor say aye.
Aye.
The amendment is approved, and we have then before us the vote on the committee substitute as amended. Do I have a motion? I have a motion.
Yes, sir. Mr. Chairman, I recommend do pass.
I have a motion.
Bill 1115 with amendment.
I have a motion to do pass as the House substitute to House Bill 1115 as amended. And do I have a second?
Second.
I have a second. All those in favor will raise their hand. Okay. All right, and all those opposed, like sign. And the chairman votes no. All right, we have to take up House Bill 11. How much? 1444. And this is Representative Maxwell's bill. Representative Maxwell is not able to be here this evening, and we're going to proceed on his behalf. And I'm going to ask, this bill is in relationship to the insolvency pool, and I'm going to ask the president of the insolvency pool to come up, Ms. Lemke, and enlighten us on this bill.
Thank you, Mr. Chairman. I am Nancy Lemke with Allstate, and I do serve as the chairman of the Georgia Insurers Insolvency Pool. Last year, you passed House Bill 407, which made some updates to the provisions in the insolvency pool. And what we've discovered is in the effective date section of the bill, we lumped all of those changes together, and we should have separated them. There's a number of changes that apply to the administration of the pool, such as the makeup of the board and some just general administrative things, and they should be effective upon the date that the bill goes into effect. We also made some changes on coverage issues, such as we increased the amount of a claim from, say, $100,000 to $300,000 for a homeowner, and those would be effective on future insolvencies. So any insolvencies that occur in the future would get those coverage changes, but the other administrative changes just need to be in effect when the bill is effective, which was last July. So what we'd like to do is just make that clarification and just split them out and say one section is effective on future insolvencies and all the rest are effective on the effective date of the bill.
All right. Any questions of the members? Anyone here to speak on this bill? All right, then we have before us thank you. We have before us House Bill 1444. Do I have a motion? Do I have a second?
Second.
All those in favor say aye. Aye. Those opposed, like sign. Thank you, folks, for staying late this evening.
Thank you, Mr. Chairman.
Since
Mr. Chairman, thank you. I got to go to Black Hawk.